Hi, everyone. Thanks for joining us today. I'm Chet Jorgenson, MAPE Statewide President. Our country and our state are facing unprecedented times as we band together to fight the COVID-19 virus. We thought it was important to get members together so we can update you on what we've learned through our discussions with the administration about the work and work sites of state employees during the pandemic. MAPE employees are Minnesotans first and state government workers second. We join our neighbors and other community members in this fight against COVID-19. MAPE members, of course, are rising to this challenge. Our priority is to support and serve our fellow Minnesotans from Austin to Ely. Our professional employees who are serving on the front lines of the Department of Health are performing extraordinary work. They're in the thick of it and in putting dozens of extra hours as they perform the tests that determine whether Minnesotans have COVID-19. They're also showing incredible grace and patience as they answer hundreds of phone calls from concerned Minnesotans. As I mentioned, our members are putting in many, many hours, yet those working in an infectious diseases divisions were not eligible for overtime or comp time. Like you, we didn't think that was right or fair. So we negotiated with the administration to ensure members working in an infectious disease division will receive overtime for all the extra hours they're putting in to keep Minnesotans safe. In addition, I want to thank Minute members who have been working long, hard hours, including weekends, to make telework possible for many more state employees. We also led labor negotiations with the Waltz administration to develop a COVID-19 leave policy for state workers. The administration and MMB have heard us about paid leave. They're instituting a COVID-19 health leave policy, which means employees will not have to use vacation or sick leave for COVID-19 related time off, including school or child care center closings. I'm going to turn it over now to MAPE's Executive Director, Lina Jamoul, to update us on the new leave policy for state employees.
Thanks, Chet. Good afternoon, everyone. This is MAPE Executive Director Lina Jamoul. It's really good to see so many of you join us on the call today. I think it speaks to the need of people to come together right now in the face of uncertainty. And we're certainly living in extraordinary and challenging times. All of us at MAPE are deeply appreciative of all the work that members are doing to keep Minnesotans safe during this pandemic. As the COVID-19 global pandemic threatens many aspects of daily life, the hard work of Minnesota's public sector employees ensure that our state agencies continue to operate with minimal disruption to the vital services Minnesotans rely on. All of you right now are the unsung heroes of our state and our country. And our job as a union has been to gather all the concerns that have come up in the last few weeks, take them to the governor's office into administration, and get resolution on as much of them as possible, as quickly as possible. MAPE has led discussions with AFSCME Council 5 and all other public sector unions with the administration during this unprecedented time to quickly respond to an ever-changing crisis. We're working to support our members so you can provide the quality, reliable, vital services our neighbors rely on and ensure your safety at the same time. As Governor Walz said, this peacetime emergency places burdens on state agency employees, as with all Minnesota workers. It also places special responsibilities. And it places special responsibilities on all of us, but I want to lift up a few of our areas that have added pressures during this time. That's the infectious disease unit in the Department of Health, all our workers in the 24/7 operations from the Moose Lake Prison and Direct Care and Treatment to St. Peter Direct Care and Treatment, Anoka Regional Treatment Center, and all the facilities, all the state prison facilities. You are under tremendous amount of pressure right now with not as many options as other folks have, and we're fighting as hard as we can to ensure both your safety and that you are made whole during this process. Our folks in unemployment insurance in the Department of Economic in Department of Employment and Economic Development have got tremendous burdens and responsibilities being placed on them, and we're fighting hard for you as well. And Chet mentioned our folks at Minute who are working really hard to make sure people have the equipment they need to be able to telecommute. So to protect wages, hours, benefits, and other working conditions during this time of uncertainty, we've secured the following provisions for state employees, and this has been in negotiations with the administration for the last couple of weeks. We have guaranteed paid leave will be extended to all executive branch staff. That means everyone at the state agencies, and that also includes men state employees, so employees in the state colleges and universities who need to be absent from work due to COVID-19, either in order to take care of themselves or their children due to school closures, or to take care of someone else that has COVID-19. And this will be in place for the duration of the governor's emergency executive order. The 35-day waiting period for new employees to be eligible for health insurance has been suspended. So that means that all employees with less than 35 days of service will now be eligible for health insurance. We are fighting that all copays and health-related costs due to COVID-19 are waived. The administration does need the legislature to act on that, and we are working to make that happen. These benefits apply to our members and state workers. In addition, Governor Walz has announced financial provisions to help non-government workers across Minnesota cope with the pandemic. He issued an executive order to help ensure that workers who are not able to work as a result of COVID-19 have benefits available. At a time when unparalleled actions to this pandemic have become the norm, we must also recognize the magnitude of the latest executive order, Executive Order 2007, which the governor issued last night, that grants the MMB commissioner the authority to waive any state policies, procedures, or rules, including the collective bargaining agreement, if they deem it necessary to be able to protect the health and safety of Minnesotans. Now, we know that our collective bargaining agreement provisions represents decades of hard work and progressive governance, and that this is a serious action taken in a time that requires bold leadership. We are not going to stand in the way of the state's powerful response to this crisis, but we will not idly sit by if that power is abused. We have worked with the state to put a system in place to ensure these changes are used only to respond to COVID-19. Our job as a union is to make sure that during this worldwide crisis, Minnesota workers are still protected and safe at work. We are proud of all the work state employees do at this time. We are all being called to go above and beyond, and I have confidence in all of us to rise to the call. Look to our website, Facebook, and Twitter in the coming days. We'll find ways to highlight the amazing work that MAPE members are doing right now. So I wanna talk about our priorities at the moment, and the questions and the concerns that have been coming have to do with people's ability to telework and with people's ability to use paid leave. So our priorities as a union is to advocate and navigate people's requests for telework as quickly as possible, and requests for paid leave. So please let us know, particularly if you're having problems teleworking or if you're having problems getting the paid leave. MMB sent out the COVID-19 paid leave an hour or so before we started the Teletown Hall, so that should be being sent out to agencies. And if you need it from us please get in touch with us and we'll send it to you too, so you can have the information and the rights that are available to you. As I said earlier, we want to put some spotlight on the hard, never-ending work that members are performing in the Minnesota Department of Health, who are analyzing COVID-19 tests to determine if Minnesotans have contracted the virus, and they are monitoring folks who have come back with a positive diagnosis, as well as answering hundreds of telephone calls and many other things. So joining us now is Sarah Evans from the Department of Health, MAPE member, MAPE leader from the Department of Health, who can tell us what it's like being at the epicenter of the pandemic here in Minnesota. Sarah is the chair of the organizing council, too.
Great. Thanks, Lina. Can everybody hear me?
We can hear you, Sarah.
Okay, great. Yes, so as Lina mentioned, I am an employee at the Department of Health, and as you can imagine, we are responding to the pandemic in so many ways. I am a little bit removed from it at the moment, which works out well, so I can be on the call today, let you know what's going on. But I'm certainly learning about a variety of ways that this is changing our work as we are really kind of rising to the challenge and responding to this pandemic. We are currently expanding our public hotlines daily. So we have people, not only people in infectious disease and people who tend to do these types of hotline jobs doing the work, but we have volunteers from all over the department that are coming in and taking phone calls from the public on just during the day and also on evenings and weekends. A lot of people are calling in who feel sick and are, wondering what to do and need to hear a calm voice to kind of help them think through their personal situations and give them the most up-to-date and clearly presented information on this situation. We also have hotlines for healthcare providers, making sure that providers have all of that most up-to-date information. We have people that are collecting information about, the up-to-date research, what's going on in other parts of the world, and keeping that information organized behind the scenes so that everybody is getting the same information. And we also are reaching out to our community partners that we work with across the department. So lots of meetings popping up, all of this work that we've been previously doing, shifting to COVID as we navigate through this difficult situation. And I've been, in contact with a lot of people I know in different areas and programs. They are shifting their work to align with CMS and CDC guidelines and how to respond in this new environment. So lots of contacts at the federal level and getting guidance there. Personally, as I mentioned, I work for the health economics program, and so my work typically isn't on sort of the front lines of these things, but MDH has sent out surveys and is assessing the ability for other staff to be available for other types of activities, whether it's note-taking, whether it's data collection and data analysis, which tends to be my personal area, and figuring out a plan for how to involve more people as this situation progresses. I also wanted to just give an update on something else that MDH has been doing. We had a training yesterday for psychological first aid, which I really appreciated. It was one of our behavioral health preparedness coordinators, and she offered some really great tips on mental health that I thought I would just highlight on the call today. She mentioned that it's just really important to stay connected to friends, family, especially anyone who might be isolated and be in need of some kind of connection, even if it's just lending an ear to listen to somebody and what they're going through during this time. And then to also just, remember that you have power over your own thoughts. think about how you manage your time looking at media, especially social media. I know, I've been getting caught up in that a little bit, as I think we all have, and really think about your own personal plan to be resilient through this time. Have a list of positive coping responses and think about maybe things that you will do every day moving forward. I know that a lot of us are teleworking these days, so trying to come up with schedules. For me, I'm going to try to do yoga in the morning. We'll see how that goes, but I'm just really thinking through what you can do in your personal situation. And then lastly, I just wanted to highlight a couple of resources for employees. So remember that you can always reach out to the Employee Assistance Program, or EAP. It's a free confidential consultation for state employees on matters involved in your personal and professional life. You can call that hotline 24 hours a day, 7 days a week. There also is a federally funded disaster distress helpline, and I have information on both of those that maybe we can send out to people in some way. There's also a responder self-care app that I didn't know about, and it's a collaboration between the Department of Health and the University of Minnesota. I think it's really important to remember as state employees, even those of us that don't work at the Department of Health, that we all are still responders to this. And there may be many of you out there and your colleagues that, are picking up more work, or your work is changing. So you are also a responder. You're also taking, a lot of this emotional stress on yourselves. So I am going to look into getting information on that self-care app as well. And lastly, I did hear, I don't have more details on this, but if you're familiar with the Headspace app, it's an app that you usually have to pay for, but it's a meditation app. I've used it. It's really pretty amazing, and I've heard that it might be available for free, so I can look into that as well. But yeah, I think we can all be leaders here, helping people get the information they need through all of this. And I appreciate all of you for all of the work that you're doing, and that so many of you are on this call today. It's really pretty extraordinary.
Thank you, Sarah. We are going to be taking questions from people, so press *3 to get in line to ask a question. So *3 to get in line to ask a question. There are a lot of participants on the line, so I'm not sure if we're going to be able to get to everyone's questions, and we may not have answers to all the questions. But please do press *3 to get your question. To ask your question. And if you are experiencing challenges with telework in your workplace, please reach out to MAPE. You can email action@mape.org, and we will route that to the appropriate staff person to help advocate on your behalf for swift telework arrangements. It looks like we have a number of questions that are being queued up right now. I just want to reiterate that our priority in the next few days here is going to be advocate and support our members through navigating telework requests as well as any paid leave requests. We have a number of state employees that are in the emergency worker category. We know that our folks fighting, we know that people in the infectious disease unit in the Department of Health are deemed emergency workers, as are all the employees in the Department of Corrections. We are advocating for state employees in the direct care and treatment program to also be classified as emergency employees, as well as our state employees who are in the unemployment insurance area to also be classified as emergency employees. That means that that category has schools, available for any elementary school children. So we're both trying to get clarity from MMB of who is included in that category, as well as advocating for our members to be included in that. There's a question here from Laura Chet. Can COVID leave be used for school closings intermittently, even if you're teleworking already? We believe so. The COVID Leave 19 policy that's just come out an hour or so ago allows COVID-19 leave to be used in the event of school closures. Another question from Shakopee here. What does MAPE know about implementation of the COVID leave for essential staff when it says including caring for children? That is unknown right now. If you are part of it, looks like that person is from the Shakopee facility, so would be deemed as an emergency worker because they work for the Department of Corrections. You should inquire about COVID leave if you need to use it to care for children. We're definitely going to be advocating that that COVID leave is available for essential staff. There's a question here from Wendy. Employee group coordinator at DHS. In this time, in stress and uncertainty, some supervisors are doubling down on time tracking. Is there any way for MAPE to communicate to management? Now is not the time to scrutinize, rather support and understand. Absolutely, Wendy. You're 100% correct. Sometimes in times of uncertainty and fear, the best of us comes out, and sometimes the worst of us comes out. And if you are having problems with your manager or supervisor, please let us know. We will talk to MMB about providing some training swiftly for supervisors and managers on how to manage workers in a remote environment. We think that's going to be needed. We think this will probably be the new normal for months to come, and they need to invest in some training on their managers and supervisors of how to do that effectively, manage people remotely.
I think, too, there's just going to be a lot of technical problems as they try and roll out teleworking so rapidly. And we're all going to face issues of something not working or working slow. And I think managers are just going to have to take that into consideration. So I would just echo what Lina said, is that the importance of, contacting MAPE, contacting a steward or business agent if you're having trouble.
The question here, if our daycare hasn't closed but we feel it is unsafe anyway, can we use COVID leave? Nothing prevents you from requesting COVID leave. So I would encourage you, if you need to do that, to go ahead and request it. But the policy, and we're reviewing the policy right now. It just came out before we started the Teletown Hall, so we may get more clarifications. The policy is clear that it is for school and day closures, but nothing prevents you from requesting it. There's a question here from a member who works in a crisis home and has lung disease and should not be working. If you have a doctor's note that says you should not be working, you could use that to request COVID leave, no matter where you work. There's a question here about whether the same new options and benefits and rights apply to temporary unclassified as well, and the answer to that is yes. The question about can we use COVID leave and work, i.e. use it to supplement unworkable hours. I do not see a reason why you would not be able to do that. again, work through your supervisor and request it. For example, if you need to, you're able to work one day, but the next day daycare is difficult, you are able to request that. They have said that you can telework and look after your child at the same time, which is a change from the normal telework policy. So what they've told us that they're trying to do is be as flexible as possible. And so I would advise that you do request the leave. Reading through some questions here. The question, I've been ill for a week or so. I don't qualify for COVID testing, but I feel ill and staying home. Am I eligible for COVID leave for that? This is the gray area that we have been pushing MMB in the administration, that if people are exhibiting cold and flu-like symptoms and are being told to stay at home, that they should be eligible for COVID leave. They are still trying to work that out or not. I don't see what agency you're with, the person who asked this question, Cindy, but we want to gather the situations and the circumstances where people are staying home because they're not well, but don't have a positive diagnosis. So we want to track those and make the case that you are eligible for COVID leave.
There's also a question from Commerce about a requirement that you're supposed to come in at least one day a week, even if you're teleworking. They have the ability to adjust your schedule, but if you meet the criteria in the policies, where you shouldn't be coming into work, you can then use that leave to be gone 100% of the time. But if you don't meet those criteria and the criteria doesn't change, then the department can have you come in one day a week.
Okay, there's a question here about how many hours of COVID leave are being granted, or what happens in the case of people who don't have enough work to do from home to fill out the day. Well, in terms of COVID leave, it's unlimited leave right now because we and nobody knows how long schools are going to stay closed. We don't know what the recovery period is for folks who do end up with testing positive for COVID-19. And so right now it is an indefinite amount of time. There's no limitation to the leave. And in terms of enough work, I would really suggest working through your supervisor on that and find creative ways to do work. They are allowing people to telework, and they're going to keep paying people to telework, and you can talk to us more offline about your specific situation. We have a question for pregnancy here. For people who are pregnant, can people use COVID leave for pregnancy? We are still trying to get clarification on that. As far as we know, the policy doesn't address that specifically. But again, if you have a note from your medical provider saying, recommending you stay home, that would help your chances to be eligible for the COVID leave. Again, dial *3 if you have a question. There's a question about who is a approving COVID leave requests, at what level, how does one get approved? This question from Angela. Thanks for the question, Angela. That, again, the policy just came out just before we started the Teletown Hall, so we'll need to look at that, but it will be the same kind of process that you would work with your supervisor and agency HR for any other type of leave. If there is a new special process that's going to be set up, they haven't told us that yet. And if they do, we will let you know as soon as we know that. But right now, our understanding is that requests should go through your normal avenues if you were requesting sick or vacation. No. There's a question here about whether your COVID leave would deplete your accruals, and no, this is an additional leave to be used in these extraordinary circumstances of this pandemic, and vacation and sick accruals would not be affected if you are on COVID leave. The question about whether the executive order covers the Minnesota state system, that's state colleges and universities, and then in state central office, the answer is yes. There's a question here of how am I supposed to learn yoga when the fitness centers are closed? Sarah, that may be a question for you.
That's a great question. Maybe what I can do if we want to follow up with some of these resources that I mentioned, there are so many online platforms that are doing yoga and meditation. I could put in a few recommendations there.
Thanks, Sarah. We have a question here that says, my child's daycare is closed. How do I go about requesting COVID leave? Supervisor said he'll get back to me. How is it decided who gets COVID leave, and what's the process for response? That is very clear in the COVID leave policy that if for daycare or school closures you are eligible for COVID leave. The policy did just come out, less than 2 hours ago, so your supervisor might still be catching up to the policy, but go back to your supervisor and let them know. The agencies ought to be communicating with folks, and we'll put the policy up on our website too, so you have it. And you can, you'll absolutely be eligible for COVID leave if your daycare is closed.
There's a question about pre-existing conditions, if the leave covers that, and yes, it does. So if you have something that your doctor will certify that you should not be at work during this pandemic, then you can provide that. You can also just let your supervisor know. They may not require a doctor's note, but if they do, go ahead and get that doctor's note, and then you should be able to work from home or get the leave.
Thanks, Chet. There's a question here from Anoka Medical Regional Treatment Center, Direct Care and Treatment. It says, we are continuing to receive admissions, and they have not been screened before admissions. We've expressed our concerns to administration. What can you do to help? This is from a rec therapist at AMRTC, a recreation therapist. We are gathering, and Caitlin Reed, CREID at MAPE.org, is working with our folks with Direct Care and Treatment. We're going to be gathering input from our Direct Care and Treatment people and meeting with the Direct Care and Treatment Administration promptly to discuss these issues. We know that there are particular issues that are affecting folks in our direct care and treatment, and we're going to be sitting down with that administration as soon as we're able to. So that's very helpful to know that they're having admissions without screening. Thank you for that information.
question?
If there is information like that you see that you feel are making your working conditions unsafe, please let us know about that. You can let us know on this call, or you can email us action@mape.org.
There's a question about if you're trying to telework from home and the equipment's not working. I think we're all going to have to be patient. Our fellow members in Minute are trying to create a huge teleworking network in a matter of less than a week. And so what you should do is contact your supervisor to say, your equipment's not working. Ask them what you're supposed to do. More than likely, you'll just have to wait until they get the VPN or whatever's not functioning up and running. And there's just going to be so many moving parts where just all of us are going to have to show a lot of patience.
There's a question here from Tabitha. What are we doing to keep MAPE staff? Tabitha, I'm assuming that means the staff who work for MAPE. And that's a good segue for me to talk about some of our changes in the office. So we have encouraged all of our staff to telework. We have not closed the office or prohibited staff from coming in, but right now the 90% of folks are working from home, and those who are coming in are choosing to do that. We've also provided our staff with the same paid leave that the governor's provided to state employees. And we are moving all union activities. We're going to be moving union activities online so that we stay connected to one another. We're gonna need each other during this time, and we are better together. It's going to look different, though. But we are committed to keeping members and staff connected to one another in a safe way, as well as ways that we can support our communities during this time. So look for that to come in a couple of weeks. But the priority right now, as I talked about, is the telework and the paid leave.
I just found out that we're up 17. We're up to there are 17 more cases of COVID-19. We're up to 77 now. In speaking with a member who thinks that she has it yesterday, the challenges that she has faced, and I think anyone who becomes sick at this time, the challenge they're going to face is when you call into your doctor, they may not want you to come in. There may be a way that they're going to try and triage you. What they told her is that they were pretty sure that she had the COVID-19, but because of the extreme shortage of test kits, they're only they're taking tests of people who they are concerned might be in a life-saving situation, and they need to know whether they need to treat the person for the flu or COVID-19. I think this is going to present a challenge for the agencies in that we as employees are not always going to be able to get a note that says we have COVID-19 or we're sick, or if they want a note for us to come back to work before they'll let us come back. These are all things that are going to have to be sorted out. All of the plans do have a program that you can contact a doctor virtually, and one is Doctors on Demand for Blue Cross and Blue Shield and Health Partners, and the other one is MD Live for Preferred One. What we don't know, and we've asked CGIP to put on their screen, is if you can go to these web-based doctors and get notes of should you be gone or is it safe for you to come back. And so please keep watching the MAPE webpage. As we get more information, we will pass that on to you as soon as we can.
Yeah.
And I think, too, there's just, even at your work site, you're going to get a lot of wrong information from supervisors and HR. And as that happens, we're going to have to fix it and correct it as we go. part of the issue is that these circumstances are changing so rapidly, and sometimes M&B is making a decision and realizing they need to amend that decision, and it doesn't always get to all the HR people and supervisors in time. So, again, if you start having problems, reach out to MAPE.
Yeah. There is, MDH does have on their website a list on what is considered an underlying condition. I just got that information from a Department of Health and MAPE member, so please do use the MDH website. It's an amazing resource. There are more questions here about emergency leave. How and when can we learn about who is considered an emergency worker from essential staff? We are trying to get that information from MMB, and as soon as we have it, we will put it out to you. Right now, the information we have that we know for sure are people working in the infectious disease unit in the Department of Health and employees in the Department of Corrections. There is no talk of a hiring freeze at the state right now. We're trying to read through these questions.
Someone asked, how long is this going to go? Nobody knows. I think that there's certainly a lot of hope on the part of the governor and health officials that if as many people telework as possible and stay away from, the restaurants and the bars and do social distancing, that we can get through this without a lot of people catching the virus in a shorter time. But it's really hard to know. And I think, as Lina had mentioned, there's no timeline limit on this leave, and there's no amount of hours limit on it.
The question here from Jennifer Arthur looks like we've been told we cannot telework. A lot of us take Metro Transit, and we're told all express stops will be done, and we have transportation issues. Can you, Jennifer, we're going to take your name here and number and get back to you. We want to know if people are being told they're not allowed to telework. That is in contradiction with the governor's orders, so we will intervene. How will this impact Connect 700 folks, and what kind of leave might be available to those who have mental health issues, or are there things arising from this that aren't COVID? That's a really good question, Megan. The Connect 700, for folks who don't know, is a way for people with disabilities to be able to have more accessibility to state employment. And we are going to ask that question of MMB and get clarification. Our stance is going to be that no one is harmed because of this pandemic. And Sarah talked about EAP being a free resource for state employees. So I really would encourage folks to use that.
Somebody asked about how this might affect our contract. So we have been in conversations with the governor, the Speaker of the House, and the Senate Majority Leader to emphasize to them that should this be a short legislative session, there are certain things they have to do, and one of those is pass our contract. They all have acknowledged that they understand that our contract has to pass this session. And so I feel like it's going to get through the process, even if the legislature significantly shortens their session.
There's a question here. Would employees be required to be reassigned to other state agencies or just within our agencies with the new policy? The answer is yes. They will reassign work. They will also reassign work location. in order to keep people safe. So that may happen. We have not heard of that happening yet, but that may well happen. We have a question from the Department of Corrections in Moose Lake. We've been modifying our programming, but we also had a large group this morning with 50 guys in one space. Any discussions on agencies who don't seem to be modifying activity following the governor's recommendations? Yes, absolutely. We are aware of the problem in the Department of Corrections and the lack of ability for the employer to do social distancing in those conditions. We are setting up a call imminently here in the next few days with the Deputy Commissioner of the Department of Corrections, Michelle Smith, and union representatives from each facility to both get clarification on what they're doing to keep people safe, as well as be able to provide our input of what we think they should be doing to keep people safe. Once that happens, we will put out a special communication to our Department of Corrections folks who work in the facilities.
We have a question from someone who has a kidney transplant and works with other people who have chronic health conditions and wondering what happens to the work if they can't do the work. So, first of all, as MAPE members and as Minnesotans, I'm really happy to hear that you're concerned to make sure that the work gets done. We all have a commitment to our work and the people of Minnesota. But with that said, if you meet the criteria for a health condition, you need to use the leave and get out of your work site. And if you can telework, to do that. If you cannot telework, it is the responsibility of the employer to put you on the leave and have you go home until they can find some type of area or position where you could work and not have to worry about spreading the virus. But we do know, in looking at the CDC and Minnesota Department of Health, there are people who have conditions who should self-quarantine at this time and stay home as long as they can, because if they got the virus, it could be catastrophic. And if you fall into that, just make sure you're in conversation with your supervisor. Get the leave, get home, be safe.
Question here from Brian. Are the state and MAPE working together to consider hazard pay for those required to work, especially in dangerous places? Absolutely. We just talked about this to the MMB commissioner yesterday. For hazard pay, we are going to push for them to negotiate that with us. We are also talking about bonus pay for people in the unemployment insurance division who are required to go above and beyond right now. And we did secure overtime pay for our folks in the infectious disease division. So absolutely, we're working on that and pushing on that, and we will update you when we have resolution.
Somebody has a question for Sarah. The best place to keep up to date on the test kits, vaccines, etc. Also, departments being restructured, our jobs are up in the air. Are there any protections at this time? So, Sarah, do you want to take the first part of the question about test kits and vaccines?
Yeah, I'm trying to think. I mean, I'm just looking at the MDH site right now. There is, and maybe it's better to send that out with some resources, but there is an MDH page that's called Situation Update for Coronavirus Disease 2019, and I have been refreshing that page so you can get an update on the number of cases. But I can also just look into, I've been following a number of resources, so I can include that in as well in like a little resource update for everybody, and have links so that people can easily navigate to that information. For vaccines, I don't, I'm hesitating on a source for that. I'd rather just kind of take a look, and then we can send that out in an email.
The other part of the question is about, any kind of restructure that's happening at a college or an agency. I mean, there is no reason that anyone should be laid off during this time. The issue is making sure that we have enough people at work to continue to get the work done, to keep the government functioning, to participate in our economy. So at this point, because of the virus, I have not heard of, nor do I see any reason why anyone would be laid off. And you may be given different work. There will be a handful of people that might happen to, but not laid off.
There are a lot more questions here. We may not be able to get through all the questions, but we're going to use them to inform resources that we've put out. We have a COVID-19 tab on our website that we'll keep updating, but I'll try to quickly get through as many as we can here. So how might COVID leave affect eligibility for FMLA or paid parental leave if needed later in the year? The policy does not clarify as far as we know, but our position is that this emergency leave due to the pandemic should not affect any accruals or any benefits whatsoever, including FMLA and paid parental leave. Will all of our health insurance and benefits continue on COVID-19? Yes, absolutely. All health insurance and benefits will continue. In fact, we in the administration are working to try and expand that and make sure that co-payments and healthcare costs related to COVID-19 are waived. There was a question about who at MAPE do I contact if I have problems with telework and leave. Please contact action@mape.org.
I think there's been some questions about, can I use just regular sick leave? That's kind of going to be, I think we're going to have to sort through that, because you may have a situation where you're just regularly sick, or you throw out, if you throw out your back or you hurt your knee or something, you're not going to be able to get the COVID-19 for that, absent some type of injury that would cause you to have increased risk of infection from it. So you will have to use sick leave for that. I think where it gets tricky is if you appear to have, or you think you just have a common cold, but you don't really know, how will the agency use that for the COVID-19? I think we don't know yet. We are hoping that M&B and the agencies side on go on the side of public health and just tell people, look, even if you have a mild cold and you normally come to work with that mild cold, don't come. We're going to give you the COVID-19 if you're afraid of burning through your sick leave. I don't know if that will universally happen, but it should.
We're working here to extend this call because of the volume of participants and questions. We don't control the technology, so we might not be able to do that, but we are working to extend this call. I do want to say there was a question about, will MAPE be organizing donations and so on. Yes, absolutely. Once we get through this chaotic crisis time for the first week or so and get into a new normal, we are going to be looking for ways to keep members connected to one another in safe ways, as well as establishing donations and pools of ways so that we can help each other, including someone had a good idea for toilet paper. If MAPE can try to figure out how to get toilet paper either to our members or to members of the community who run short. So we're gonna try to work with our suppliers if we can order a few extra here, since no one's coming in the office, but they may be available. But what we want to do right now, the priority for the next few weeks is to figure out the telework, figure out the paid leave, and in the places where our members are at risk in the Department of Corrections and Direct Care and Treatment to intervene there quickly. And once we do that, we will be looking at ways that we can all support each other during this time.
There's another question about what happens if the person's job is to work with the public. I believe that most agencies and colleges are in the process of not having members of the public come into the college or the agency, that folks will be required to either email or call in instead of come in person. There's no reason for you to believe that your job is in jeopardy. If that's your normal thing, that it's really up to the college or agency to make sure that you're getting those calls and those emails that normally would be just someone walking in.
There's a couple of questions here from colleges, both from Mesabi Range College and from Normandale College, asking about we're getting mixed messages from the chancellor and from the college leadership. The chancellor put out a very clear message. That is the message that ought to be followed. Your campus leadership, it may take a while for them to catch up with that. And I do know that the Minnesota State Meet and Confer team is working on scheduling a call with the chancellor to get clarification on campuses and colleges. But you ought to be teleworking if you work for a campus or a college.
What is being done for employees who work in the field, like inspectors? Yeah, that's going to be a hard one. At a minimum, you have to insist that there has to be social distancing. If you are in the field and you cannot social distance, then you need to talk to your supervisor about an alternative way to do your job. But with all of us, for every job in the state of Minnesota and the colleges, at a minimum, you have to be able to social distance. And I know there was a comment prior where they packed a room to give people training on how to use their computer at home so that they didn't have to be around other folks, but the room was packed. And yeah, I've heard a couple stories about that, and they shouldn't be doing that. You have to have the 6 feet between the next person, even if they're trying to train you so that you can telework, so that you're going to have less exposure.
There's a question from Darlene here about the executive order that the governor issued yesterday about waiving responsibility to abide by our contract. Could you please clarify? Yeah, the governor issued an executive order yesterday, which he does not need our permission to do, that gives authority to the commissioner of MMB to waive any state policies, procedures, rules, and collective bargaining agreements if the commissioner feels it's necessary to keep the Minnesotans healthy and safe. So right now, that was signed yesterday. They haven't waived any of our rights. All of our rights are intact, but the governor gave the commissioner the ability to do that. We, all of us, all the state labor unions, met together and met with the governor's office and MMB to talk about this. We learned of their intent to do it, to sign this executive order on Monday afternoon. And what we were able to do is modify the executive order to put a commitment in there to work in partnership with the unions. So a commitment to work in partnership with the unions is in the executive order now, which it wasn't in an earlier draft, and to work with us on an expedited process if issues arise because of waiving sections of collective bargaining agreement, that we can have a process with MMB in the governor's office where all unions can use an expedited process to resolve issues. Again, we don't know how it's going to work. We don't know if they're going to use this. We don't know to the extent of it. We do know that the governor, due to the peacetime emergency, has given himself that power and has given the authority to the MMB commissioner. We got legal counsel on this, who told us that they are able to do this, and that while we understand it's a sobering thing for them to do, there is no executive power that will take away our ability to come together, to take away our ability to have a voice, and that takes our ability to put pressure on the employer to do right by employees. We have those rights, and we'll exercise them for the benefit of all Minnesotans.
Somebody asks, what happens if Metro Transit closes down? I think that at that time, MAB is they're going to have to expand the COVID-19 leave to that. If you don't have a car and you can't walk to work, you're either going to have to telework or be given the leave. I mean, there's nothing that you can do about it.
A question from Chandra here. I'm out of work on maternity leave, and my paid leave is up next week. I'm home with a 2-year-old whose daycare is canceled. Will I have to use sick leave, or can I use the COVID leave? You would be eligible for the COVID leave in this situation because daycare is closed.
Another person asks, as a diabetic, am I qualified to take the COVID leave? Go to the Minnesota Department of Health to check the pre-existing conditions. If you have anything that falls under that pre-existing conditions, talk to your supervisor. If they won't let you either telework or give you the leave, then get a doctor's note.
Question here, can we work with MMB to not mandate doctor's notes? Lots of people being told not to go to the clinic so they can't get a note. That's a question from Andrea. Yes, Andrea, we will work with MMB to make it as easy as possible for folks given these unusual circumstances. Got a question from Barb here. We're fighting for everyone. Can we encourage everyone on the call to become members of MAPE? And thanks to agencies who have been flexible in working with us. This is Barb from the Min-State Meet and Confer team. Absolutely. This is the time for us to stick together, and that's what we do as Minnesotans.
Somebody talked about taking the COVID leave for school closure if the children are older. So the cutoff is 12 years old unless they have a pre-existing health condition that requires your presence. Okay.
There will be a Q&A on the website for this. There's a question from Susie. We have a COVID-19 tab put up on our website, and we'll be updating that regularly. We are recording this call, so that's going to be available for folks too. I know there's a lot of information coming at us, and it's changing a lot of the time. There's increased fear in times of uncertainty, and not all of these questions have answers right now. But we'll all do our best to work alongside each other to get through this.
I want to thank everybody for being on this call, and like Lina said, we will try and get information out as quickly as we can. We didn't have time to answer everybody's call, but thanks for everything that you do, and we will continue to do our best. This probably will not be the last all-member call that we have, but thanks to all of you, and make sure you take care of yourself.
Thank you, everyone.
Bye.